We really see Nurse Call as being the fundamental aspect to the hospital's wider digital strategy. We will show you how our enhanced Nurse Call solution can help improve staff and ward efficiencies as well as patient safety. Ours, like any other Nurse Call, can be as simple as pressing a button at the bedside and a light appearing in the corridor, but having worked on a ward myself, nurses are very mobile around the area. The key part of our Nurse Call solution is its mobility aspect. We want to make sure our Nurse Call alerts are visible and accessible from anywhere at any time. So we introduce mobile technology and send Nurse Call alerts directly to smart devices that the team are carrying. Here, I will initiate a call from a patient's handset, which will turn on a light outside a patient's room and a sounder in the corridor. But the alert will also appear on the mobile device, showing the location of the patient call. I can now initiate several workflows from my mobile device. If I'm available, I can simply select Accept and attend the patient's bedside. I can press Decline if I'm busy, and it will automatically be sent to another member of the team. But if I accept, I have another option, which is to initiate a call directly to the patient's bedside. This is extremely helpful when we're seeing an increase in single occupancy rooms. Patients are feeling disconnected from their caregivers and also staff from their patients. A key benefit for staff is that it allows nurses to triage and prioritise around the Nurse Call alerts. So does my patient require pain relief? If so, I can now get the medication en route to my patient's room. Or is my patient telling me that they're feeling very unwell? Do I need to go to the room immediately? And this really helps drive simple efficiencies for staff. We can also help promote patient independence around the bedside. We can use the patient handset to initiate in-room workflows, such as controlling room lights and blinds, maybe even their hospital entertainment system. We can also use the handset to initiate workflows such as pain relief request buttons or toilet request buttons if a patient requires specific assistance. That request will then be sent directly to the assigned staff, creating context to patient calls with targeted workflows. We now move on to how we initiate non-clinical workflows at the bedside to teams within other areas of the hospital. Our Nurse Call solution comes with workflow buttons, and these can be programmed in different ways depending on the user's needs. We can, for example, create a porter call from the bedside. This eliminates the need for staff to leave the patient's bedside to use a phone, and the request will go straight to the portering hub and to the mobile devices of the porters, where they can accept and reject accordingly. This creates time saving and drives efficiencies around these types of non-clinical processes. We can also use it to send an alert to domestic staff to improve bed turnaround times, which is what we implemented in one of our hospitals, where they saved 45 minutes per bed per day on the turnaround of a room. We can also use the workflow buttons to simply turn on a coloured light outside a patient's room and use it as a room status indicator. For example, if a patient has a known infection in a side room, we can select the infection control workflow button and a light will appear outside the patient's room, making staff aware that they need to take precautions before entering. These are all ways in which we can help drive efficiencies using simple workflow buttons at a patient's bedside. We then move on to clinical tasks and how we can help alleviate some pressures off staff by alerting them when tasks are due. Tasks can be initiated from the mobile application or at the patient station at the bedside for routine daily tasks, such as taking a patient's observations or turning a patient. I simply select tasks from my application and create the task required. Once that task has been created, it will then send a reminder to gently prompt staff when the task is due. This really benefits staff as they have such a heavy cognitive load with many things to remember at once. So we want to make their lives a little easier by alerting them when tasks are due. Initiating and completing tasks at a patient's bedside allows us to create point-of-care access, so staff don't need to leave a patient to input information into other hospital systems. Observations can be taken and recorded at the bedside on a mobile device or at a patient station, with information automatically being uploaded into the hospital EPR system. Avoiding duplication, human error, and time-consuming processes, giving nurses time to care for their patients.